me great pleasure to extend our warm welcome on behalf of Internal Quality Assurance.
This meeting is being recorded.
Warm welcome on behalf of Internal Quality Assurance, Vinaha Mission Annapurna College of Nursing, Salem, conducting one-day webinar on grievance and leadership, governance and leadership, a tool for quality enhancement in health sciences institution. Hearty welcome to one again. First of all, I welcome our Honorable Chancellor of the Nation, Vice Chancellor Dr. P.K. Sir, Honorable Vice Chancellor Dr. P.S. Manoharan, Honorable Register Dr. Jacob, and all the directors in this occasion. First of all, my glad welcome to our Honorable Dr. P. Gnanasegar, Director IQAC, VMRFDU, for your consistent support and strength of our success of this webinar, sir. I welcome you, sir. Next, I welcome the Director Research, the Honorable Satyamurthy, sir, for your presence and support in this webinar, sir. I welcome you, sir. It is a great pleasure to welcome such a noted personality as a resource person for today's webinar. That is none other than Dr. Srimati Arora, Professor cum Principal, College of Nursing, AIMS, Rishikesh. We are honored to have you as a resource person for this virtual webinar, ma'am. I welcome you, ma'am. Next, I welcome our Dr. K. Mageshwari, Principal, Vinaha Mission Annapurna College of Nursing, Salem, for your support and encouragement in all our academic endeavors, ma'am. Welcome you, ma'am. Next, I welcome all the HOAs and HODs and faculty members of constituent colleges of VMRFDU for your presence in this webinar. I welcome you all. Next, I welcome all the faculty members of Vinaha Mission Annapurna College of Nursing for your support and presence in this webinar. Welcome you all. Once again, I welcome everyone gathered in this occasion. Now, I request our Honorable Principal, ma'am, Dr. K. Mageshwari, ma'am, to unfold the theme of this webinar. I welcome you, ma'am.
Director, IQAC, VMRF deemed university, respected Director Research, respected, dignified, eminent speaker, today's resource person, respected Dean and Principals under VMRF deemed university, dear faculty and students, very good morning to all of you. Leadership in governance is the willingness and ability to take ownership in a part of an organization and to continually do what is best for that organization. Effective leaders stand on a foundation of solid governance principles. They have a clear mission and vision for the future and align the decision with them. Leaders in governance follow a specific strategy and help to create a conducive culture to success. The key attributes in governance leadership are team building, skills, empowerment, trust, and a willingness to listen and suggestion with an open mind. Good governance envisages transparency in decision making, implementation, and easily availability of the relevant information. And effective leadership is proactive in sharing about the value, vision, approach, and future. To become an effective leader in governance, this webinar will be helpful. Thank you.
Thank you, ma'am. Given the ideas about the governance and leadership, how it will improve the quality of the health sciences institution. Thank you once again, ma'am. Now I request Dr. Gnanasegar, Director, IQAC, VMRFDU, to felicitate the gathering and give the keynote address in this occasion, sir. I welcome you, sir.
Thank you, Dr. Nagarandani. Very warm morning to all of you. It's my pleasure to be before you on this ninth quality webinar series. A series of webinars being conducted by the internal quality assurance cell of the university in association with the constituent college IQACs. I first of all congratulate the IQAC coordinator of Annapurna College of Nursing and the principal for hosting this webinar. And it's wonderful to have today's chief guest, the right person for the right job. So that is the first principle of leadership. Finding the right person for the right job is the first principle. So I really congratulate the principal and her team for selecting the right person as a resource person for today's webinar. When we look at leadership, leadership is something which involves finding a parade and getting in front of it. That's what John Naisbitt said. So being a leader is not just sitting in a chair and commanding people. You should be the front runner as a leader rather than the person who is in the back commanding. There is also another saying: delegating works, provided the one delegating works to. So the leader should be an example, not just a person who commands. He also should work. So in today's scenario, we find people who they just push people to work, but rather they don't work. They are mere word watchers. There was a movie where Vadivelu used to have a scene where someone was pushing the bus and one other person standing beside was telling push, push, push. So here, who is the leader? The one who pushes or the one who says push? So finding the right person for leadership is very important in governance. And specifically in health sciences institutions, having the best leader really helps in running the health sciences institutions. So today's topic is really essential, and I look forward for the lecture by Dr. Smriti Arora, and I wish the webinar a wonderful success. Thank you.
Thank you, sir. Thank you for your wonderful speech. Now I request Dr. Satyamurthy, sir, Director Research, to felicitate the winner.
Well, I'm sorry, I'm not really prepared, but anyhow, let me say a few words having you called me. Very good morning to all of you, and first congratulations to Director IQAC and IQAC cell of Annapurna Nursing College and Principal of Annapurna Nursing College for conducting this webinar program on a very, very important topic, governance and leadership. This is, in fact, the burning problem in general throughout the world and more so in our country. Why we are not able to achieve the heights which we deserve is lack of quality governance and leadership. And Dr. Nyansakran has given an example. I mean, you push, whereas the leader has to do the job with his hands and be a model. And especially when the leader wants to achieve more with the given resources or limited resources, the motivation, that is extremely important. This is where the leadership and governance comes. And if I am sitting in the shade and ask him to push the bus, certainly that will not have a motivation, right motivation. But if I also give a hand, I mean, certainly things will be much better. In fact, in our system, I mean, I'm not talking about VMRF, I'm talking about in general in our country, leadership in various institutes. This governance and leadership plays a very important role, and more so in health sciences institutes where the service cannot be bought just by money alone, where the motivation is extremely important for giving the best of the services to the patients. This leadership thing is extremely essential. I mean, in fact, my taking my age into consideration, I personally feel that many of the people are not really looking for the pay packet alone. The motivation, the happiness which leadership provides to the employees. Everybody cannot be bought with money alone. But well, I'm not the speaker. I think Dr. Smriti Arora will be able to give a better insight. That leaders, for their ego, doesn't permit to keep motivating their colleagues in the right path, and especially a tool for quality enhancement in health sciences issues. Again, is a very important topic. As I mentioned, in health sciences, you are dealing with the human beings, human lives, and the leadership plays a very important role. Well, I mean, this is what ran in mind at this second, and I wish the webinar all success, and I look forward to the resource person giving the talk. Thank you very much.
Thank you, sir. You have rightly said that about the leadership and also governance. Now we will move on to the scientific session. That is, now I call upon the Dr. Sumiti Aurora to take the session. Before that, a brief overview about the madam. Madam is currently working as a professor cum principal at College of Nursing, AIM, Rishikesh, and she is a recognized PhD nursing guide at Indian Nursing Council. She has the working experience of more than 20 years. She has completed her BSc Nursing and MSc Pediatric Nursing from College of Nursing, AIMS, New Delhi, and PhD Nursing from National Consortium, Indian Nursing Council. She has a previous working experience at Amity University, Haryana, and Jamia Hamrad, New Delhi. She appreciated by the Indian Academy of Pediatrics for her contribution in basic newborn care and resuscitation programs. She has undergone course in traditional Chinese medicine at Beijing, China. She has published 2 books and she has more than 200 citations for her publication in various journals. And also she is a national trainer for COVID-19 pediatric care, NRP, HIV for AIDS. And she is a national mentor for nationwide quality of care network for quality improvement under Lakshya, that is a labor room quality improvement initiatives, and MUSCON, that is a ensuring child-friendly services in public health facilities. So she is a mentor for the National Quality Care Network Quality Improvement Programs. We are very much honored to be a resource person in this webinar, ma'am. Madam can take over the session.
Thank you so much, Dr. Naganandri, for that beautiful introduction. At the outset, I would like to pay my humble gratitude to the management of the whole Vinayak Mission University and the College of Nursing, the principal, the director IQAC, and the director research, and all the management authorities. Thank you. And today I'm lucky that I have been given a chance to speak in front of you. So let's start the session. I would like to share the screen. I think someone is sharing the screen. Can you stop that? Because it is saying you cannot start the screen share. Someone is sharing the screen. Can you stop that? If you will stop sharing, then I'll be able to share my screen.
Naganandani, நீங்க தான் ஷேர் பண்ணிருக்கீங்க. Right.
Okay. Just a minute. Okay, is it visible to all?
Yes, ma'am. Yes, ma'am.
Yes, ma'am. Yes, ma'am.
So beginning our session today, we are going to talk about governance and leadership, a tool for quality enhancement in health sciences institution. So in the next 40 or 45 minutes, we are going to see what is governance, what is leadership, what is quality enhancement, and how governance and leadership can be used as a tool for quality enhancement. So what is governance? Governance encompasses the system by which an organization is controlled and operates, and the mechanisms by which and its people are held to account. So what is governance? It's all the system and the processes by which the top management people, they are working in order to make sure that the people are getting high quality care. And meanwhile, whoever are the stakeholders, they are held accountable also for delivering the right services. So the elements of governance are ethics. So they have to function in an ethical manner with honesty, with integrity, following all the rules and regulation and the laws. Another element is risk management. So they need to be aware. They need to do proactive planning that, okay, what are the risks and how can we prevent that? Nowadays, the consumer is very intelligent, right? So before coming to the hospitals, they already have done a lot of research in the Google about their disease. So you have to be very sure that what care you are giving to them, it is legally and ethically sound. Then governance also ensures that whatever the framework is there within the system, the people are complying with that. So compliance is ensured. And it also involves administration, which needs to be very transparent and ethically sound. So governance enables the management team and the board to run organizations ethically, legally, sustainably, and successfully for the benefit of stakeholders, including the shareholders, the staff, clients, and the customers for the good of wider society. So if we see the healthcare system, that is being managed by whom? Either it can be a private sector or it is a government sector. So in both the areas, you have someone who is on the topmost position. It can be a director, it can be a president, it can be a dean, it can be vice chancellor. So there are 5 or 10 key responsible people who are making the policies, and whoever is there in that board members or the decision-making people, they have to make sure that whatever policies they are making, they everybody, of all the shareholders who are getting affected by that decision, so that you can give the best quality care to the customers. And who are our customers? Those are the patients who require a very good quality care. So governance refers to making, changing, monitoring, and enforcing the rules that govern the demand and supply of the health services. So whenever we are working in the health services, there is certain demand and we need to supply the care. So as we have seen in the last 2-3 years, this demand and supply, it has been changed. You know, suddenly we were exposed with this COVID-19 disease. We were not knowing. So there was a lot of demand. We needed a lot of beds. A lot of infrastructure rearrangement had to be done. So the health system must be smart enough, must be resilient enough that you can make changes depending on the situation. And if the governance is good, then you will be able to make all these changes. You will be able to monitor that what changes are happening and now what further decisions need to be taken. So the areas of governance activity includes clear decision-making process. So who is making the decision? The top management, the board members, they are making the decision. How they are making the decisions? By taking viewpoints of everybody, of all the stakeholders. Who are the stakeholders? These are the NGOs. These are all the medical and technical staff, the nurses, the doctors, the citizens, the patients. So you need to, and the person who is funding you, right? The finances. So a clear decision-making process has to be there after discussing everybody. So there has to be open and honest communication, a transparent system of communication. So a good governance, they behave openly by reporting on their activities. So you must have seen how our Prime Minister usually works. He has started something new like Man Ki Baat. So whatever the new policies he's going to start, he talks about that. So regularly he's updating us about the policies. And there are a lot of survey forms which are circulated, and he wants to know the public opinion also, that what do they want. And based on that, they would like to make the decisions. And the same thing applies to the health sector also. A good governance, they actively engage with their stakeholders. They effectively manage the risks they face. So the latest risk which we have faced is the COVID-19. And now we are continuing with the sequelae of COVID-19. So every day the new viruses are coming. So how our country has very nicely dealt with this pandemic. So a lot of policies, initially it was a very new disease. We were not aware that how to tackle this disease, but slowly as the new evidences was coming, every fortnightly, every monthly, the protocols were changing, right? Like the mask system, the COVID appropriate behavior, these were something which we had not practicing earlier, but now they all became a normal part of our life, that we need to wear masks, that we need to maintain social distancing. So COVID appropriate behavior, it's something becomes the norm for us. So we effectively manage the risks. A good governance, it takes the responsibility for controlling and protecting their assets, including their reputation. So all the countries globally, everybody was dealing with this situation. So similarly, India also, along with the public and private partnership, with the support from the citizens, from the healthcare sector, from the doctors and the physicians, they try to control this pandemic. And fortunately, today we have succeeded in that. So the reputation is saved. Now, talking about governance in healthcare. So it is a structure that holds boards and the leaders accountable for continuously improving the operations, clinical staff and processes, society and financial performance. So governance in the healthcare, we can say that it can be divided into two things, that is clinical governance and corporate governance. Clinical governance includes caring for the patients, managing clinical practices and administration, maintaining and improving the quality of and safety of patient care, that we are delivering the best care to our patients. That is clinical governance, usually done by the physicians and the nurses and all the members of the health team. And another component in this healthcare is corporate governance. It encompasses many matters that are not players at all in the clinical governance. For example, you have an accounting department, financial department, investment in the human resources, you have IT facilities, and two governance are there which need to work parallelly, simultaneously, in sync with each other, so that the best care can be given to the people. So corporate governance, it includes all your administrative part, your clerical part, your accounting, financing, human resources, and IT facilities. So they both have to work parallelly together in sync with each other. Now, what are the stakeholders? The three main categories of stakeholders who interact with each other, they determine the health system and the governance. So these stakeholders these are the state, the health service providers, and the citizens. So state means what? So these are the government organizations and the agencies at the central and the subnational level. So at a country level, if we see, we have central government, we have union government, then we have different state governments also who are making policies. So, and there is Ministry of Health and Family Welfare, who is making different policies and protocols, how to tackle different situations. And then it is percolated at the lower level, at the state level, at the district level, at the village level, where we need to follow all these protocols. Another stakeholder is the health service providers. Health service providers are your doctors, your nurses, your paramedical staffs, your physiotherapists, your ANMs, your ASHA workers. So these all are the health service providers. And the third stakeholder is the citizen. Citizens are the population representatives. It includes your patients. It also includes the associations, the NGOs, who become the service users when they interact with health service providers. So there are three main stakeholders who need to be discussed, who need to participate in all the decision-making process when we are dealing with healthcare institutions, the state, the health service providers, and the citizens. So leadership and governance, it ensures that strategy, policy frameworks exist and are combined with effective oversight, coalition building, regulation, attention to system design, and accountability. So there are two terms which we are talking about, governance and leadership. So governance, as we said earlier, it was all the processes which is taking place within the system so that good quality care can be given. And leadership is also very important. As earlier the speakers were telling, that the leader, he has to be a role model. He has to show everybody that what is the correct behavior, what are the correct techniques, how it is supposed to be done. He has to be a motivator. And this good leadership and governance, you have to ensure that whatever policy framework you are making, it is within the legal and the ethical system. So health leadership, it plays a crucial role in redirecting the workforce. Now, whenever we are working in the health system, you can have a lot of problems. So as a visionary leader, you need to identify what are the problems and what is the best way to solve that problem. For example, in your healthcare system, we can see that there is a lot of turnover taking place. So if a lot of turnover is taking place every time the new people are coming, so you need to acquaint them with the policies and procedures of your system. So you need to train them, you need to coach them. So you need to find out also, you need to find out that what is the reason why people are leaving, why we are not able to sustain more people. So you need to motivate the workforce, you need to find out the cause, you need to think deeply about the situation, and then you need to devise or plan various interventions which will work for you. And for every health institute or the institutes, the context is different. Their problems may be different. The local problems may be different. The state levels problems may be different. The problems may differ according to the different scenarios and the different management system, different cultural systems are there. So you need to find out that, okay, if something is working in that institute, whether it is going to work in my institute also, so that you need to foresee that, okay, what system works best for me, and then you need to motivate people to follow those guidelines and make sure that whether it is working or not working, and if it is not working, then how we can improve upon it. So health leadership, it will help in redirecting the workforce. It will help in increasing the job satisfaction. If the people have trust in their leader, they will openly communicate. Now, for example, if we see an example of medication errors, if somebody has done a medication error, whether a nurse is responsible or a doctor is responsible, if they are always living in a fear that, okay, I will now get some punishment, so they will not come to you and tell. But if a trusting relationship is there, they will come to you, they will report to you, and timely management can be done, and whatever the risk could have happened to the patient, that could have been averted. So health leadership is also important for professional development of the people. For example, if we see in a government scenario, right? Everybody likes a government job. There is a stable salary. And once you get a job, you might not feel like further studying or further, intellectually stimulate you. But it is the responsibility of the leader to make them understand that professional development is also very necessary, because every 5 years, after some time, the knowledge is changing, the new developments are taking place, the new equipments are coming. So everybody has to be acquainted with the new methods of treatment, with the new therapies, and you need to plan some in-service education programs for them, and they must be motivated to participate in that. So you need to see that whether your team members, they are actually wanting to learn more, or there is some apathy in them, or whether they really want to work for the in the best manner for the patients. And if not, that how can we stimulate the enthusiasm in them? Health leadership also involves burnout prevention. So this is the major problem in all the healthcare institutes. We see our country is having a lot of population. Hospitals are usually crowded, especially in the government scenario. Sometimes we don't get bed, we don't get oxygen. This is something which has happened in the last few years. So what was happening to the nurses and the medical staff? Continuously, they were working, and once they were infected, they were quarantined, they were not going to the home also, there was no emotional support. And in their societies also, when they come back, if the neighbors, they come to know, okay, that this nurse is suffering from COVID-19, then they were telling, okay, you cannot enter the society. So there was a lot of emotional trauma also. So if the leadership is good, if you have given the good services to the nurses or the other members of the health team, whether it's the doctors also, then this burnout prevention can be done. So this is a fact that the nurses, the medical team is burnt out. There is a lot of workload, and how we can manage this thing, that a good leader has to devise the plans for that. So leaders are constantly challenged to meet the shifting expectations and set the new priorities. So whatever the way in which we were working 1 year ago or 1 month ago or 5 years ago, it is not necessary that we can continue to work in the same manner, because the environment around us is changing. The things are changing. New technology is coming, new knowledge is coming, people are moving every time from here and there. So constantly you need to keep on making changes. So you need to keep your eyes open, all the senses, you need to keep it open. You need to be aware that, okay, what is happening in all the departments? What new changes I need to bring about so that we can give the best care to our patients. So that is our ultimate goal. If we talk about the government sector or the private sector, you are taking money from the people to deliver them quality services. So you are accountable. And for that, the leader has to be very vigilant. And whenever he is working, he has to work in the most honest manner, in an integrity, and with open and clear communication, clearly telling the people that what is the vision, what is the mission, what are the goals, and what is to be done. And by role modeling through his own behavior, he need to inspire others to work in that manner. So health leadership is the ability to recognize the priorities. So what is the priority at present? What are the things which needs to be done first? That needs to be done. And then what are the non-urgent things? Then we can focus on that. It offers the strategic guidance to all the problems. First of all, you try to identify that what are the gaps existing in your system and how we can fill in those gaps. What is the best method to solve the problems? And create commitments to achieve those priorities. So that's why nowadays people are putting a lot of emphasis on quality improvement, quality assurance, and quality enhancement, because lot of hospitals are there. If you want to attract patients to your hospital, so there must be something extra that you are providing to the patients so that they can come to you. So your reputation is at a stake. So that's why quality becomes very important. As I said earlier, the consumer or the patient, he is very intelligent. He will ask you 100 questions. He will do all his history checkup in the Google and then come to you, and then it is your responsibility that you answer the questions, you justify, you give them rationales, why this treatment is being given, why that is not given, what are the side effects. So you need to be very well aware of everything. You need to have good knowledge, skill, and you should know how to very well communicate. That trusting relationship, the good interpersonal relationship, it needs to be maintained. So successful leadership encompasses the knowledge also. You need to be knowledgeable about the system. How does it work? What are the pitfalls? What are the good points? You need to have skills and the ability to engage with a different workforce. Different workforce means because the workforce is changing again and again. People are moving. You have to deal with people of different temperament. Some people will easily listen to you if you want to bring about some change in your system. Some people will not listen to you. Then how to motivate them? How to build a good team? How to identify who are the people who will be involved in some productive work? So you need to find out the systems or the dynamics which are existing in the system and how to make best use of that. So leadership provides a unity of purpose while also establishing the direction of the organization. So the leader, who is usually in the topmost position, he must have a very clear mission and vision of the organization, which needs to be explained to all the members of the health team so that they can work in sync with each other. Leaders, they create and maintain the internal environment where employees are able to become completely involved in achieving the organizational goals and aims. So what is the organizational goal? What is the aim? Why we are working here? What is our objective? So that must be clear with all of us, with all the members of the health team, whether it's a physician or a nurse or an orderly or a group 4 class 4 employees. So everyone needs to understand that we are here for the patients and we need to deliver them best services. So what are our goals? What are our missions? So it is the responsibility of a leader to explain those things to them. So the key healthcare leadership skills involve strong communication, right? So everyone must feel free to approach you whenever they want to say something. Your doors must be always open. So there should be no hesitation. So you cannot exercise your power through fear. So there has to be a trusting relationship between you and your people. So listening to and sharing information with colleagues and patients to improve the patient outcomes. So the communication, there has to be a good communication between the leader and the members of the health team and also with the patients who are our consumers. So there should be a system. For example, you can have a feedback form. The patients can fill it and then you'll come to know, okay, where the gap is existing. For example, when you're working in an educational institute, you can have one suggestion box outside. Usually I see in all the wards when we work in the hospitals, no suggestion box is there, or outside the dean office suggestion box is there. So it is another method of communication that you are trying to know that, okay, what are the problems of the people and how we can rectify it. Another skill for a leader is that he is emotionally intelligent. So when you are working in such an environment, you know, it is a stressful environment, the hospital environment. People are falling sick, people are dying, there is a lot of depression surrounding you. Then there is a health workforce who is overloaded with work, right? 24 hours, sometimes more than 24 hours, they are working, double duty, they are working. Sometimes the staff doesn't come. So there are a lot of issues. So every minute you are doing crisis management. There may be a time when you really would like to burst out, but you need to be emotionally intelligent. You should know how to calm yourself, how to work in all these stressful situations. So you need to understand and manage the one's emotion in a positive way with improving communication and empathy. So before reacting, you try to put yourself in their shoes and then try to understand their point of view, and then you respond. So you need to keep your emotions under control. You cannot burst, you cannot shout, you cannot bully anyone. So all those things cannot be done. Another skill for a leader is he's a good problem solver. They need to think critically, logically, rationally that, okay, these are the problems existing. He will make a good team. They will try to find out different methods to solve that problem. And then they will decide mutually that what is the best solution to that problem. And then they will implement it. Another important leadership skill is time management. This is the very, very important thing. If you don't do things on time, then you will always land up into the crisis. So, usually when we are working, we know what are our allotted work. It is 8 hours or 9 hours. So how we are going to utilize that time? How much which activities? So you need to prioritize your activities, which is very important, which is urgent, which is non-urgent, where I'm going to utilize my time best so that finally we can achieve the mission and vision of our system. So mastering a fast-paced environment by juggling the workloads and delegating the tasks when necessary. So delegation is also very, very important. So you cannot be a perfectionist. So you need to trust people. You need to give some of the work to your subordinates also, but you will be accountable for their actions. So try to identify who is good in what, right? What are their key qualities? So there may be a lot of people who are having a mix of qualities. So you need to identify them, and then you need to delegate the tasks to them, and then make sure, and then you need to do regular follow-up also. If you will not do follow-up, then the people will also forget, and you will also forget. So have a whiteboard in your office. Keep on writing, okay, that on this date, this needs to be done. You can have calendars, you can have reminders, you can have alarm systems. So time management is very, very important. Another very important leadership skill is flexibility. You need to be very, very flexible because the health system is changing, people are changing, every day your needs are changing. So what was working tomorrow, it is not necessary that it will work today also. So today you need to redo your plan. So you need to be flexible. If you will all become very rigid, no, I need to do things in this manner only, then the things will get difficult. Okay. So embracing and adapting to the changes in the work environment is very important. So you need to continuously update yourself, have an open mind, listen to everybody, and then you put those things into action. So flexibility is very, very important. You cannot be rigid in such type of system. So the qualities of healthcare leader are, these are the 5 important qualities, which includes he shows humility, right? Even though you are very much high educated, you are sitting on a very high position, but you need to be humble with everybody. You may not agree with someone's opinion, but you cannot be harsh to them, right? You can discuss, you can communicate, there are ways. So communication skills is very important. How to disagree with each other respectfully, that we should know. A good healthcare leader, he has a vision. He knows that, okay, this is my goal. I am working in this institute for next 5 years or 10 years. And by the end of my tenure, I would like to accomplish all these things. Okay. So he has a good vision for the organizations that I want my institute to be best in the country. I want that whatever the surgical cases are coming in my hospital, they should all go to the home within a defined period without any infection, without any post-op complications. So like that. So different goals or visions or missions can be there. A good leader will act as a mentor. He will help to build the team. He will identify the key strengths of different team members, and he will guide the people by giving the example of himself. So you cannot tell other people, like the earlier sir was saying, no, you cannot tell them push, push, push. So you also have to push so that people know, okay, that she's also working. So we all have to work together. He demonstrates integrity. So unbiasedness, avoiding partiality, that should be the, we need to appreciate people for their good work. And if somewhere something wrong has happened, so that there should be equal consequences for everybody. So you cannot be partial. You yourself has to be honest and you need to be unbiased, and similar treatment has to be given to everybody, irrespective of their gender, caste, or creed, or any other thing. And a good healthcare leader works in collaboration with everybody. So you cannot work in isolation in your own room, sitting in the four walls. So for delivering a high quality care, you need to collaborate with different members of the health team. It can be a community medicine department, it can be radiology department, it can be trauma surgery department. So with all those departments, you need to collaborate. You need to find out that how the things should be done so that we can give good care to our patients. So collaboration, interdepartmental collaboration, collaboration with other institutes and other universities, other hospitals, with other stakeholders, with different political leaders, with different groups of people who are getting affected by our decisions. So collaboration needs to be done at every step. So research shows that effective leadership is a crucial factor when there is an ongoing change in an organization. And the leader's job is to create an inspiring vision that can motivate the employees to work towards a common goal. So people always look up to their leader or to their boss, right? So you need to conduct yourself in such a manner that the people are getting inspired and they also give their best. Now coming to the another concept of today's webinar is quality enhancement. So quality enhancement is a process of augmentation or improvement. Improvement is often used to refer to a process of bringing an activity up to a standard, whereas enhancement means raising to a higher degree, intensifying it or magnifying it. So we may have a particular standards for which we are working, but now we want to enhance it. We want to intensify it or magnify it. We want to increase the quality in our system. So that is quality enhancement. So the concepts of quality enhancement are that it starts and ends with the satisfying customer's need. Now, who will determine that you are giving a good quality care whenever you are working in the hospital? The people, those who are getting affected by that care, they will determine the quality. The patients, they will tell us, okay, the quality of the care which we have received in this hospital is very good, and that hospital it's not very good. Okay, this department in this hospital is very good, and that department in that hospital is very good. So the quality is defined by the customers. It also involves continuous improvement of every process to meet the internal and external customers' needs. So you need to have the feedback mechanism, a method of communication with your consumers so that you come to know that where are the gaps and where improvement is needed. And continuously we need to do these improvement processes in our system so that every time we are delivering a good quality to our patients, a good services to our patients. Quality enhancement also involves statistics to measure the variation. So data collection, the numbers, these things are very important. The records and reports, right? So if we say that the quality of care in this department is not good, how we will come to know? That we will come to know through records and reports only, right? The nurses, the doctors, everybody, they are maintaining so much of records that, okay, today these many admissions were there. This was the temperature of the baby at the time of admission. These are the infection rates. For these many hours, I've given the kangaroo mother care. So you have all the records with you. So with that records, you can determine that after surgery or after a particular intervention, how many of them landed up with different post-operative complications? What was the infection rate? What was the follow-up rate? And why the patients are getting referred so much, right? So data, the statistics is very important so that you come to know what is happening, what has happened in the last few years or the last few weeks, and what is our goal, what is our aim, what do we want to improve, and how we can do it. So why is quality enhancement necessary? When a healthcare institution aspires towards excellence and patient safety, quality enhancement proves to be a key factor essential to the process. If you want your institute to be called as Center of Excellence, then you need to give them quality care, quality education or quality care, whether you're working in the university or in the hospital. So that is very important. And the top management commitment is very important in this process of quality enhancement. Why? Because these are the people who will decide that where to allocate the budget and the resources. You can deliver quality, but you need, and how to deliver that quality? You need to have a system which needs money, which needs infrastructure. So the commitment from the top management, from the top leaders who are the main stakeholders, it's very important. These are the people who will monitor the progress and they will plan for the change if needed. So the domains of healthcare quality include the clinical leadership and governance, environmental management, promotion of safety of the workforce also and for the patients also. Evidence-based practice needs to be done. The medical and technical competence should be there. Whoever is providing the care, you need to give person-centered care and you need to have positive interpersonal behaviors. So for healthcare quality, these are the several domains, and one of the important one is clinical leadership and governance, which needs to be exercised in a very ethical and legally sound manner. So why quality is linked to governance issues? Because we have customers and they are paying tax to the government. The taxpayers' money is being utilized to run the institute. So you need to give them high quality care. Accountability is an increasingly important element in the governance of healthcare institutions. So you need to be accountable for your actions. If you have given the care in this manner and not in this manner, and whatever the end result has come in, so you are accountable for the consequences. And the quality is linked to governance issues to protect the consumers, because we don't want the consumers to go with a bad experience. We want to give them high quality care. So to protect them, the quality is very important. Now, what are the tips to improve quality management, leadership, and management? So for a good quality leadership and management, the leaders or the management, they need to be proactive and lead through examples rather than dictating. So you need to, foretell that, okay, now the summer season is coming. Now I am expecting these type of more patients here. So what all facilities should be available in my hospital? For example, in the winter months, different types of diseases will be coming. So those seasonal diseases, you need to be aware that, okay, and if, for example, some pandemic is occurring and you are thinking that, okay, this can happen in our country also. So you need to be prepared beforehand to manage all these situations. For example, some disaster has happened, some earthquake has happened somewhere, some landslide has happened. So you know that, okay, now there is going to be a lot of patients in our hospital and now I need what all facilities, and we need to redo the shifts of all the people also. So proactive planning is very, very important. And you cannot tell people to work 24 hours a day and then you will sit in your house and not do anything. So as a leader, you need to show them that, okay, you are also working, you are involved in the process, you are getting affected by the process. So you cannot only dictate. So role modeling, your behavior, how you conduct yourself, that is very important. Another important quality of good leadership and management is you understand and react to fluctuations in the external environment. So what are the changes which are taking place in the external environment, whether it is at the national level or at the state level, and how it is going to impact our health institutes, that also you need to know. So like I said earlier, you need to keep your all the senses open to find out what is happening in the external environment, what is happening in the internal environment, so that necessary steps can be taken beforehand to avert the crisis. A good leader, he considers the wants of all the stakeholders, from customers to owners to employees, the suppliers, the local communities, and the general public. So whenever you are making any decision, you make sure that everybody is in sync. They all agree to that, because if you are making a decision by consulting everybody, then there are more chances that they will comply to that. The compliance will be more. Otherwise, you will face a lot of resistance. Establish the common values and ethical role models throughout the organization. So this is very important. Make sure that everybody is working in an ethical manner. The common values, honesty, integrity, all those things are taking place. And if someone is not doing, then what are the steps to be taken that you need to do? So leader instills a sense of values and ethics that are entrenched in the organization's mission statement, and acting as role models to inspire the employees. They establish a clear view of organization's prospects. A clear view of the organization's future is essential in order to accurately plan ahead by continuously changing the goals and milestones in the future, right? If you see the WHO also, right? Earlier they were Millennium Development Goals, then they progressed to SDGs. There were certain milestones based on their indices. India has framed their own goals. Some of the milestones we are able to achieve, some of them we are not able to achieve. And when we are not able to achieve at the national level, the government will be making some changes. And based on that, it all is going to affect the functioning in our health system also. So the vision and the mission and the changes which are taking place in the external environment, all we need to see and then plan our work. Good leaders and the management, they develop trust and they eradicate the fear. So everyone must be feeling free to come to you and talk to you about anything. So that level of trust must be there. You need to equip employees with the needed resources and freedom to strive for the duty and accountability. Now you have to tell them to work, but you haven't given them the resources. So then you cannot expect a good quality of care, right? So whatever the things that are needed so that they can do their work nicely, you need to provide them also. And then they can be held accountable that why this service was done and that service was not done. So quality also means that you need to provide good infrastructure. Another important quality is foster open and honest communication. So different methods of communication are there. You can have meetings, you can talk to them, you can email to them. So it should not happen that there are some obstacles in the communication, they did not get the information, and because of that, the care to the patient was affected. So there must be a system of communication within your institute. It can be emails, it can be WhatsApp groups, it can be any manner. Another important thing is, as the health scenario is changing again and again, you need to teach, train, and coach the employees. Now, new types of ventilators are coming, new equipments are coming. So regularly you need to update their knowledge and you need to make sure that they are skilled enough, they are competent enough to deliver good quality care. So the advantages of quality enhancement process is that you will be giving the safe care to the patients. You will avoid injuries to the patients which are caused by treatments intended to help them. Our goal is to give best quality care to the patient. Our goal is not to injure him or to cause any harm to him, but sometimes it might happen. But if these processes are ingrained within our system, then we'll be able to avert the errors and we will give safe care to the patients. We can give timely care to the patients, reducing the wait times and harmful delays for the patients. Now, I'll just give you one example. We went to one community health setting, and there the people of that local community, they were telling that we don't want to come to AIMS. And then when we asked them why you don't want, because there are so long queues, we never get time. It is a very long and tedious process. So this is one of the reasons. That's how it impacts the quality. So it needs to be discussed with the management that how we can give timely care. If some long queues are there, and if a person enters into the hospital from that time to the time he gets attended by a physician and he gets some treatment, if it's taking a long hour, then how we can reduce that time? So that we need to discuss with all the members of the health team, and then we can find out a solution for that. So for that, the people or the health workforce, the nurses and the doctors, they need to understand that what is the process of this whole quality improvement? What are the steps and how we can solve these small problems so that we can deliver high quality care to the people and also to the well people in the community around us. With the help of quality enhancement process, you can give them effective care, right? That whatever treatment you are giving to them, it is working. You'll be able to give them efficient care. Efficient care means within the resources which are available, you are giving them the best care without wasting anything. You avoiding the waste in particular, you will avoid the waste of equipment, supplies, ideas, or energy, and whatever the available resources are there, within those resources, you are giving the best quality care to the patient. Because of this process, you'll be able to give equitable care to everybody. Equitable means irrespective of their gender, ethnicity, geographic location, or any socioeconomic status, you are giving the equal care to everybody, right? So whether a person is rich or poor, so everybody will be given the oxygen. Then you will get patient-centered care, that is providing care that is respectful and responsive to individual patient needs while ensuring that patient values guide all the clinical decisions. So patient-centered care will be given, the autonomy of the patient will be respected, and respectful care will be given. Because one of the important areas in midwifery, we see that respectful maternal, RMC you must have heard, no? Respectful maternity care. Because earlier there was a lot of talk in the media that the pregnant woman, she was going and she could not be given the treatment because of the workload, because of the COVID situations, and they had to face a lot of hardships. In 1 or 2 cases, the baby died or the mother died. So respecting the patient, providing respectful care, irrespective of the gender, is also very important. So based on the needs, you have to give the care to the patient. Now, the aspects of good health governance are that policy making has to be done and it should be evidence-based, right? You want to make some policy that, okay, now when the people are moving in the community, they need to wear 1 mask, 2 masks, N95 mask, what type of mask? So, and there must be some evidence which you have collected, and that's how you have made the policy. So the policy making must be evidence-based. It involves systematic collection of high quality data and analysis of those data with the vigorous research methods, which creates evidence on which the decisions are made. Then another aspect of good health governance is efficient and effective service provision arrangements, regulatory frameworks, and management systems, right? For example, during those pandemic, the arrangements were done so that we can get the vaccination or we can develop vaccination in our country. And then the different trials were going on. And then in the graded manner, we were supplying vaccinations to the first to the older people, then to the younger generation, and now to the pediatric population also. Then a good governance must be responsive to the public health needs and the preferences of beneficiaries while also managing their differences. So what are the needs of the local people? You need to be responsive to that, and then you need to give them care based on their needs. A good governance makes sure that there is transparency in the policy making. Now you must have seen that there are a lot of portals available in the government where you can go and see the data about the different disease conditions. So that is transparency, that how many patients are admitted, how many are discharged, how many are vaccinated, how many vaccines came. So that is transparency in the policy making and the way the resources are allocated and the performance. Another aspect is responsible leadership to address the public health priorities. So you need to have good communication, open, honest communication. For example, the Prime Minister, like how he does is Man Ki Baat, having a regular dialogue with the people. Then legitimate exercise of beneficiaries or the citizens' voice. So the citizens, they must feel free to question, to ask that, okay, what is happening, why this is happening, how we are benefited. Then there must be institutional checks and balances. That means, like I said earlier, that the data is very important. Through data, through your records and reports, you will come to know that, okay, where are the gaps and where we need to take care. And then there must be clear and enforceable accountability. So we have people, we give them authority, and they are also accountable for their actions. So that is different types of accountability are there: social accountability, performance accountability. So the health workforce or the board members, they both are accountable for the actions because you are utilizing the taxpayers' money. Either they are, whether you're working from them or it's a government-run institute, you are bound to give them a good quality care. So the good governance includes things like they are accountable for their actions, they are transparent whenever they are making any decisions or policies, they are responsive to the needs of the people, it is the whatever the services they are providing, it is equitable, it is inclusive, the services are effective, they are efficient. That means without the wastage of all the resources, they follow the rules of the law. So rules and regulations, the protocols, the standard care plans are there and it needs to be followed. The decision making is participatory and it is also consensus oriented. So good governance is considered a core component of resilient health system. So health system resilience is what? It is the capacity of the health actors, that is your physicians and the nurses, institutions and populations to prepare for and actively respond to crisis. So whenever any crisis is there, you will be able to handle that problem, that workload whenever it happens. So that is a resilient health system, that you are able to maintain the core functions even when the crisis hits. So if you have a good governance, you will have a resilient health system that will be able to manage effectively whenever any crisis comes. And they are informed by the lessons learned during the crisis, and then they also reorganize their infrastructure, their policies if needed. Health systems are resilient if they protect the human life and produce good health outcomes for all during a crisis and in its aftermath. So good governance and good leadership, both of these things are very important to build high quality healthcare. So the goals of good governance and leadership is that we can have the improved health status, whatever the health indicators are there laid down by the SDGs and the WHOs, we can achieve them. Whatever milestones are there, we need to achieve them. And there is reduced financial risk to the users of the health system, right? So health is very costly also, right? So you need to make sure that they don't spend too much amount of money. So you have to reduce the financial risk to the users. So by focusing on governance and leadership, improved governance and leadership can contribute to a lot of effects, which includes the improved health status, the responsiveness to people, there is equitable distribution of resources, there is efficient care given, and then you are able to have a resilient health system which is able to manage whenever the crisis occurs. So through good governance and leadership, with the inputs like facility infrastructure, information system, workforce, and funds, you are able to give good quality care, the service delivery to your patients, high quality primary healthcare can be given. And then finally, you will get the beautiful outcomes. So the steps in governance and leadership are, the first one is you have to strengthen the primary healthcare policies and leadership. You need to strengthen the quality management infrastructure, and you need to ensure social accountability mechanisms that are integrated throughout the system. So national stakeholders, they must work together to define the scope and mechanisms for quality of primary healthcare policies in their context, and then to develop and implement those policies. So whenever you are defining any policies, it can be different based on your context, based on your local areas and geographical conditions and your scenarios. So based on your conditions, you will define the policies, and then you will take the consensus from everybody, and then you will implement them so that you can give good healthcare to the people. Another step is strengthening the quality management infrastructure. So in order to ensure access to quality person-centered health system, national health policies, strategies, and plans, they must be accompanied by strong, transparent quality management infrastructure, which integrates standardized care plans, diagnostic protocols, training programs, and accreditation systems. So how can you strengthen the quality management infrastructure? By making sure that all these regular frameworks are existing within your system, and there is a mechanism by which everyone knows that how to work and what to work. So there are two types of actions whenever we are working, reactive and proactive. So reactive approach means lessons you learned from the accidents occur now that the crisis has come, and now you are fixing it locally. And proactive approach means you already have systematic data collection. You can foresee what is going to happen. There is continuous hazard monitoring happening. You have your data with you. You are regularly monitoring them. You are able to foretell that, okay, what risks in future are going to come and how I can avert it. So you create and assess the effectiveness of safety solutions. So the proactive approach, it reduces the intensity of efforts invested in reactive action. So out of these two, which one is better? The proactive approach is better, and the leader must be wise enough to follow this approach. So quality management includes three interlinked concepts necessary to enhance the quality across the health system, which includes quality planning, quality control, and quality improvement. So quality planning includes the aims and processes and the goals which are needed to create an environment for the continuous improvement. And quality control means monitoring established processes to ensure their functionality. So planning and control, this we have studied in management also. So both are like twin brothers. Planning and controlling and monitoring goes side by side. And the third one is quality improvement. Is the action of every person working to implement iterative, measurable changes to make health services more effective, safe, and people-centered. So we will talk about this a little more. So the goals of quality management infrastructure is that you are able to establish an infrastructure that supports the health system so that you can deliver a safe, effective, and efficient care. It enhances the quality across the health system while minimizing the harm and reducing the waste. And it creates an environment for continuous improvement. So these are the goals of a good quality management infrastructure, that you are able to give the best care with minimum resources, with minimum wastage, and safe, effective, and efficient care is given. So as you can see in this diagram, the three main interlinked concepts of quality management infrastructure is quality planning, quality control, and quality improvement. So you have to build a culture of quality within your system. Everybody must be willing to give quality care to the patients. So the important features in developing a culture of quality include, there must be compassion, there must be coordination, they need to be engaged in the activities, the people, they must feel empowered to work, they need to have accountability for their actions, there must be values, they must be willing to learn. Teamwork is very important if you want quality in your system. There must be a system for feedback from where you can come to know what is happening. There needs to be a good leadership, transparency, and openness. So these are the important things which we need to keep in mind, that this must exist in our system so that we can provide a high quality care to the patients. Now, if we talk about the quality improvement, there are 4 basic steps in that. First, you identify a problem, that what is the problem happening? You form a team, you write a name statement. Another step is you analyze the problem. You try to find the length and breadth of the problem. And then you develop and test the changes. Based on your analysis of the problem, you'll come to know that, okay, now what changes need to be done, and then you implement those changes, and then you see whether they're working or not working. And then if they're working, you try to sustain the improvement by making the protocols, by making it as a standard that, okay, now this needs to be followed every time whenever a patient is admitted. So just quickly talking about the different steps of quality improvement, that is, the step 1 is identifying the problem. So whenever you want to identify a problem, the data is very important. You need to review the data to find out that what are the gaps. And then whatever problem you have selected to solve in your area, it must have some value for patient outcomes, right? It must be some, in your area, there might be a lot of problems which you need to solve. So first, when you talk about any project on which you want to work, take something which is easy to control, which is within your power, that you can resolve this problem with minimum resources, right? And it is of very important for patient outcome, that it's very important, it needs to be done. Then you form a team. So in that team, you look for volunteers who are very enthusiastic, who are involved, and who are influential. So by influential, we means that you need to get that these are those people to whom people will listen. They can be your administrators, they can be your bosses, and they can get the things done. So whenever you are making a team, you make sure that in your team, you have a mix of people who are getting affected by the decision. It can be the mothers, it can be nurses, it can be doctors, it can be administrators, or it can be type 4 workers, the cleaners also. Make sure that whatever a department is involved, you are involving people from those areas also. And you need to give some key roles to them, that, okay, in this team, who is going to be the leader, who is going to be the recorder, and who is going to be the communicator. Because when we are working on quality improvement projects, you need to collect data, you need to do interventions, and you need to do a lot of activities. So every person, whoever is there in the team, they need to be assigned the role. So step 2, like now first, the step 1 was you have identified the problem, you have made a name, but in the step 2, you will try to analyze that problem. I'll just give you one example. Like for example, in your unit, if you see the babies are becoming hypothermic, so you need to try to understand that, okay, why the babies are becoming hypothermic, why the mothers, they are not able to give the breastfeeding to the babies within first half an hour. So you try to find out the problems, and then you select one problem, and then in detail, you will work on that problem. And these are the different tools which you can use for analyzing that problem, for understanding that problem. That is the fishbone analysis you can do, 5 whys you can do, Pareto principle, and process flow charts. So this is just an example of fishbone. For example, the problem is hypothermia. So this problem of hypothermia, it can be related to 4 Ps. The 4 Ps are policies, people, procedures, and place. And within the policy, what is the problem? Why the what are the problems related to people which is leading to this problem like hypothermia or reduced breastfeeding? Related to place, what is the problem? So all that, this looks like a fish, so that's why we call it a fishbone or Ishikawa diagram. And this is the spine, and these are the arrows where all the causative factors will be there. So once it is in front of you in the form of diagram, you'll be able to know what is the cause and where to rectify it. Then another tool which we commonly use is 5 whys. It can be 4 why also, it can be 6 why also. It means that you keep on asking the question that, okay, if hypothermia is there, why? If the babies are getting cold, why? The blankets are not there, why? So you keep on asking the question unless you find the final cause, and then you can work on that. Another one is the Pareto principle, which says that there are a few vital tasks which are responsible for 80% of the results. And if we improve this, we will be able to get better results. The example for this is like medication problems. Like, well, the main problem for medication errors, if we see all the causes, the number one cause is prescription error. So if we will rectify that, then majority of our percentage of medication errors will be reduced. Then another one is process flow chart. So whatever the processes are happening in your system, you can make a process flow chart. Like I was telling that there is long queue and the people are not getting the treatment within the prescribed time. So you can make a process flow chart that, okay, the patient has entered into the system, he's in the line, he has made the slip, and now what are the steps happening and where is the time wasting thing happening? So once it is in front of you in the form of the process flow chart, then you can see that which steps needs to be eliminated and which more extra step we can add so that it will be of benefit to the patients. So you need to do the monitoring also. So you should be aware that what is the process indicator and what are the outcome indicators. So processes, whenever you're making your quality improvement projects, there are processes and outcomes. For example, hand washing, it is a process. So because of that, what is the outcome? Your infection rates have come down, right? For example, you have given kangaroo mother care. Because of that, the hypothermia rates have come down. So you need to identify what is the process and what is the outcome so that you can measure them. So measurement is very, very important so that you can quantify that the improvement has taken place from earlier to now, and it needs to be time bound. And then you need to plot all your events, what is happening throughout your project in the form of diagram. It can be a time series chart so that you can tell that, okay, in week 1, this was happening, in week 2, this was happening, and now this is happening, and that's how the improvement has taken place. The step 3 is testing the changes. The first one was you have made the aim, you have found the theme, and then you have identified the cause of the problem, you have analyzed the problem, and now you want to do the interventions. That is plan, do, study, act. You plan that who is going to do the change, who is going to give the intervention, how this will be done, when this will be done, for how long it will be done. And then you will analyze it, you will do the measurement of all the indicators. And then finally, on the basis of the results, you will decide whether the new technique which you have devised, whether you need to adopt it, adapt it, or abandon this. Now, the third step in the governance and leadership is ensuring the social accountability. You have to make sure that this is integrated throughout the system. It includes the opportunities for community members to identify in their local health system. So the citizens, they must feel free to ask questions that, okay, what is happening, why this is happening, and what else you are doing, what else, these are our problems and how you are planning to solve our problem. So that is your social accountability. So it is a measure of whether a country is held accountable to existing and emerging social concerns. So it is a set of approaches and tools to promote citizen engagement and monitoring to improve the system performance, effectiveness, and responsive to health needs. So social accountability is an approach initiated by the community, initiated by the citizens or the customers for collective responsibility of all stakeholders. That means they're asking the stakeholders that, okay, now you are in power and you are accountable for all the actions which is happening, and you have to give us the answer for proper delivery of services to the community. So different types of accountability is there, democratic accountability, and the main features are transparency and responsiveness. So the government must be transparent enough to tell us why they are doing. They need to release the information from time to time, what is happening, why this is happening. And then responsiveness, it includes the government actions to respond to the needs, and they need to be responsive also. That, okay, these are your requests, these are your needs, and we will provide you these type of services. So citizens, they need to be very active, they need to ask, they need to feel free. Then social accountability, the framework includes the participation from the citizens. There needs to be transparency, and there needs to be feedback and monitoring that, okay, the people are getting the care which they deserve. So social accountability, it works best with coordinated efforts from two set of actors, that is the decision-making power and the citizens. So both of them, they have to play together. So how governance can be used as a tool to enhance quality enhancement? So this is the same thing which we have talked for the last 40 to 45 minutes, that you need to engage the population, civil society and communities into policy and decision making. So shared decision making must be there. National health policies, strategies and plans, they are more likely to be implemented effectively if their development and negotiation is inclusive of all the relevant stakeholders. So if you involve them, there is going to be compliance. You need to strengthen the legal framework, a creation of a formal legal mandate, which creates a drive for action and commitment to work on policies and programs. And then there needs to be transparency. This is some of the examples of the leadership, like the PM's ability to get the citizens to exercise self-discipline, especially in the early days of the pandemic, through initiatives such as lighting the lamps to applaud the corona warriors, or banging the utensils to express the solidarity, or appealing to the citizens consistently to wear the masks. It enabled the people's participation also, which made it easier for the government to pursue the battle. So just summarizing today's lecture, so through good governance and leadership, we have crossed an important phase in the battle against the pandemic. In India, along with the central and state governments, 1.3 billion citizens, they fought against the pandemic. Successful outcome improvements in healthcare require strong leadership to make decisions, to allocate the resources, and to prioritize the initiatives. So effective governance in healthcare includes engaging the right stakeholders. You need to find the right person for the right job, establish the shared understanding of the objectives, and you need to practice disciplined prioritization. That what is most important, it needs to be done first. So the benchmarks of effective governance are the board members or the top management, they need to have clear mission, vision, and core values, which needs to be explained to everybody. You need to have competent and dedicated workforce. The decision-making must be participative. There must be transparency in the system. There must be accountability for your actions. There must be a method for continuous monitoring and evaluation, that where we are failing and where we need to correct ourselves. The key priority for everyone must be only quality, and regular coaching and training needs to be done to the workforce. So these are the references, and thank you for today's lecture.
Thank you, ma'am. Dear participants, you can ask your queries chat. You can post in the chat box.
Ma'am, till someone asks the question, I'll probably put forward my question first. Ma'am, looking at your institution as one of the topmost institutions in the country, what is the role of students in academic governance?
See, we are regularly having meetings with the students, and if you ask me, I have recently joined the institute, but I have made it a point that we have the CR WhatsApp group also, and whatever their concerns are there, we regularly talk with them individually, myself also, and I try to talk to their faculty leads and co-leads also, that and regularly, and whenever nowadays what is happening in the, especially in the MSc system, no, after the first years, they pass the exam and they go, right? So whenever they are going, we make sure that they are giving us feedback. Formal feedback form is not there, but we always tell them to write and give us that what are the things which they need to improve in our system, and then how we can improve it. And then I'm trying that I will try to improve whatever is in my power, then how we can improve it. So feedback from the students is very important. Having a suggestion box outside is very important, and sharing your vision with them, and specifically with your team members. That is also very important.
Thank you, ma'am. No one has any questions? Probably one more question, madam. Since you were telling about the suggestion box, we have found from our experience, most of the suggestion boxes are placed either opposite the principal's room or the office room, or covered by the CCTV. So how effective do you think this will attract students to give their?
Yes, you know, this suggestion, when I was working in Jamia Hamdard, no, this thing happened. The suggestion box was outside the principal office. And then one student wrote that keep it in such a place where we cannot be seen. Then the place of the suggestion box was changed.
Actually, in one of our HOI's meeting recently, we even suggested having the suggestion box in the restrooms.
Yeah. In between, you need to have informal talks with the students. You need to have the friendly attitude. Otherwise, they will be very afraid. The open communication must be there. Sometimes, you know, people misguide them also. There are a lot of destructive elements also in your system. So
Right.
you make the students comfortable that they can come to you, they can talk to you like that.
நாகநந்தனே wind up பண்ணிக்கலாம்.
Let's conclude the session. I propose the vote of thanks. A warm and graceful day to our most valuable honorable guests, speakers, participants, and everyone gathered here. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked really hard to make the success of this webinar. First of all, I extend my most sincere thanks to the Almighty God for making today's webinar a resounding success. With His blessings, and we are able to make the event what it was. Next, I would like to thank our Honorable Dr. P. Pavanyanasegar, Director IQAC, VMRFDU, for being the catalyst that stimulated us to do our best and standing as pillar of strength. Thank you, sir. Next, I would like to thank Director Research Dr. Satyamurthy, sir, VMRFDU, for your support and presence in this webinar, sir. Next, I would like to thank Dr. Surya Narayanan, sir, Deputy Director Research, VMRFDU, for your presence in this webinar. This time, I would like to thank Dr. Srimati Arora, Professor, Principal, College of Nursing, AIMS, Rishikesh. Your thoughts have enlightened us, our minds, and created a new path. We will follow it to your thoughts, ma'am. We sincerely thank you for you taking out time from your busy schedule to provide us such a valuable information. Thank you, ma'am. Next, I would like to thank Honorable Principal, ma'am, Dr. K. Mageshwari, ma'am, Vinaya Mission Annapurna College of Nursing, for your continuous support, motivation, and encouragement, being pillar for our all our activities, academic activities, ma'am. Our sincere thanks to you, ma'am. Next, our sincere thanks to and all the participants, and special appreciation to all your support, being the virtual platform of this webinar. Thank you to once again. Thank you all. Thank you, ma'am.
Thank you.
Thank you, sir.
Thank you. Thank you. Thank you so much.
Thank you, ma'am. Thank you so much, ma'am.
Thank you.
Thank you. Thank you. Goodbye.
Bye, ma'am.